take you to the northwest now, where that province's Department of Health has obtained a court order from the Ditsobotla Magistrates Court to exhume 11 bodies in search of a male patient who went missing in Thusong Hospital. The family and the department recently approached the court for an order for the exhumations. The suspected remains are said to have been buried with some personal items which could assist in the identification process. Let's speak now to Refiloe Seboko, who has been stationed at the graveyard for some time now. And Refiloe, good morning to you. The digging continues. Family members, what exactly is the story from their side? Why is this so important for them?
Well, clearly, indeed, the digging continues behind us, and we saw officials just arriving just before we finished our crossing a bit earlier together with family members. Maybe let me welcome a family member before I welcome spokesperson of the Department of Health in the Northwest Province, Ditsobotla. Thank you so much and welcome to Newzroom Afrika. Let's talk about this process today and
You're welcome, ma'am. My name is Mojalo Alfred Makinye, and I'm going to Stephen Butingana Makinye. This process is able to work out because but the identification same me waka na ditira kana ku re dumela gore marapo a ile na kra go Thusong Hospital. And therefore we have been having engagement with the department whereby collectively we agreed because based on the information in the Department of Health in a kaya gore Stephen Butingana Makinye feel purpose 2006 September mama pitling
as the family, since the passing of your dad, how has the family been in those years until today?
It's very difficult because that Stephen Butingana Makinye was the only breadwinner. You could imagine who grow in that family where there is no source of income. We have survived yes.
Closure as the family.
Definitely. Yes, ma'am.
Thank you so much for your time. Explaining there clearly that this is all because of closure for them as the family. For all these years, it has been difficult. But allow me to welcome spokesperson of the Department of Health in Tate Seboko. Mr. Lekhetwane, maybe let's talk about the identification process in identifying the 11 bodies that need to be exhumed in trying to find the missing patient.
Well, the department will be going through, or let me say the process of identification will be dictated by what we find in the first 3 graves that we are digging right now. The idea is that, or the hope is that we should be able to find the remains in the first 3 because we were able to connect with someone who was here that time when there was a burial of these unknown bodies. And the person is saying his suspect is among the first 3 that we are taking right now. But if it happens that we don't find what we are looking for in the first 3, then we'll proceed to all the 11 graves. But we are hoping that we find in the first 3. And then after that, what we are looking for is in the remains, the items that both the family and the department agree that there were some items there that can help us to identify the remains that we are looking for. If we find those remains, then the remains with those items, then our forensic will be able to collect them and go and verify them to make sure that this really are the remains that we are looking for.
Thank you so much for your time. Spokesperson of the Department of Health in the Northwest Province, explaining that the first 3 graves that has been digged, they will continue. They're hoping that in the first 3 they'll be able to identify that missing patient. And if that's not the case, they will have to dig all the 11 graves.
Refiloe, Seboko, thank you very much. Live for us in the Northwest.